effects of cardiogenic shock. There are several clinical findings associated with cardiogenic shock. They're listed here. Low cardiac output with jugular venous distension, hypotension with peripheral and pulmonary venous congestion, peripheral vasoconstriction, cool extremities, poor urine output, and altered mental status. This equation shows us the net fluid movement from inside to outside the vascular space. It could also be in the reverse direction, depending on these variables. It's essentially the difference in hydrostatic pressure minus the difference in oncotic pressure. From this equation, we can see that for arterial vasoconstriction, which is one of the downstream effects of cardiogenic shock, can increase your PC, which will increase your net fluid movement. Now, assuming these other pressures are all constant, this leads to capillary leakage and more fluid in the interstitial space, which leads to intravascular depletion and organ congestion. When you have intravascular depletion and things are leaking into the interstitial space, you'll have leakage of proteins out of the vasculature, and that can decrease your oncotic pressure, which will further increase your net fluid movement out of the vasculature into the organs.